Yellow fever is a viral disease transmitted primarily by Aedes and Haemophilus mosquitoes. It is common in tropical and subtropical regions of Africa and South America. The disease is named for the yellowing of the skin and ice jaundice that often occurs in severe cases. Causes and transmission. Yellow fever is caused by the yellow fever virus, a member of the flavivirus family. It is spread when a mosquito infected with the virus bites the human. The mosquitoes become infected by feeding on the blood of an infected person or animal. The disease does not spread directly from person to person. Symptoms. Yellow fever can range from mild to severe, and in some cases, it can be fatal. The symptoms typically appear 3 to 6 days after being bitten by an infected mosquito and can include initial symptoms: mild phase fever, chills, headache, back pain, muscle aches, fatigue, loss of appetite, nausea, and vomiting. Most people recover from these symptoms within a few days to a week. However, about 15% of cases progress to a more severe phase. Severe phase, toxic phase. In some individuals, after a brief period of improvement, symptoms return and worsen. The severe form of yellow fever may include jaundice, yellowing of the skin and ice due to liver damage, severe abdominal pain and vomiting, often with blood, bleeding from the mouth, nose, or eyes, which can lead to shock, organ failure, particularly of the liver and kidneys, mental confusion toward delirium, coma. This severe phase can be fatal, especially without treatment. Death typically occurs within 7 to 10 days of symptom onset if the disease is not managed. Diagnosis. Yellow fever is diagnosed based on the symptoms, medical history including travel to endemic areas, and lab tests. Diagnostic methods include blood tests to detect the presence of the yellow fever virus or antibodies, liver function tests to assess damage to the liver, molecular tests such as PCR to detect the virus in the blood. Treatment. There is no specific antiviral treatment for yellow fever. Management primarily focuses on supportive care, which includes fluids and electrolyte replacement to prevent dehydration, pain relief and fever management using acetaminophen, monitoring and treatment of complications, such as bleeding or organ failure, in a hospital setting. Vaccination and prevention. The most effective way to prevent yellow fever is through vaccination. The yellow fever vaccine is safe and highly effective, providing immunity for about 10 years or more after a single dose. In many regions where yellow fever is endemic, vaccination is required for entry, and it is a key public health strategy for controlling the disease. Other preventive measures include mosquito control, using insect repellents, bed nets, and wearing long-sleeved clothing to reduce the risk of mosquito bites. Avoiding travel to areas where yellow fever is common, particularly if you are not vaccinated. Risk areas. Yellow fever is mainly found in tropical and subtropical areas of Africa and South America. Countries in these regions may have specific recommendations for vaccination and travel advice to reduce the risk of infection. Some of the countries with a higher risk include Sub-Saharan Africa, particularly countries like Nigeria, Democratic Republic of the Congo, and Uganda. South America, countries like Brazil, Venezuela, Colombia, and Ecuador. Complications. If left untreated, yellow fever can lead to serious complications, including liver failure and kidney failure, hemorrhagic fever with bleeding and shock, death, particularly in severe cases. Prognosis. Mild cases generally have a good prognosis with complete recovery. Severe cases have a high fatality rate, up to 50% or more, especially in people who do not receive proper medical care. Conclusion. Yellow fever is a potentially serious viral disease spread by mosquitoes, with symptoms ranging from mild to severe. Early diagnosis and supportive treatment can improve outcomes, but prevention through vaccination is the most effective method of protection. If traveling to endemic regions, vaccination and mosquito bite prevention are key to reducing the risk of infection.